I'm Tom Getchus. I'm the Clinical Practice Director at the American Academy of Neurology based in Minneapolis. And the Academy is an organization comprised of 30,000 members who are neurologists and neuroscience professionals. For us, it's important to evolve our guideline development process and involve consumers because they provide a perspective that we don't often have from our physicians. When we incorporate patients onto these panels, they're giving us their real-world perspective. We're hearing about quality of life. We're hearing about issues of cost. We're hearing about issues that affect them the most. Maybe it's missing work. They also can use their networks to help promote that public comment period for the protocol, making sure that we're answering questions that are most important to them. We want them to engage with their networks. It could be their hospitals, it can be their support groups, but then also the patient advocacy organizations. Patients that have served on the panels also have opportunities to participate in our dissemination efforts. Almost all of our guidelines have a clinician summary and have a patient summary that's written between a 4th to 8th grade reading level to really distill that scientific evidence into a fact sheet of the disease. We offer patients the opportunity to really help shape those summaries as we promote those out on AAN.com and through other partnerships that we've created through the guideline development process. The patients are part of the panel all the way through. They will be an author on this project. They have equal voting rights. They will have a chance to tell their story. They'll have a chance to lend their perspective and have opportunities to really speak up with this group and be treated as colleagues, not as someone that's kind of pushed off to the side where we check the box to make sure that we've had that patient perspective. To acknowledge patients on guideline development efforts, they are offered the opportunity to be an author on the scientific publication. AAN guidelines are published in our journal, Neurology, so they would be right up there with the scientific authors. So there is this fear that the more people that we put on, the longer that the project is going to take. But one thing that I would say, having done a number of collaborative projects at the American Academy of Neurology, is that incorporating these diverse perspectives, including the patients, at the outset of the project is going to increase that transparency, it's going to increase that trustworthiness, and it's going to produce a better product at the end of the day. We've got that buy-in at the front end of the project. We have individuals that are passionate about answering these questions in an evidence-based fashion and putting high-quality guidance out there.